Hi everyone, thanks for coming to listen to my presentation today. You have my slides there. My title is Culture as Countermedicine, and my name is Lindsay Sampson. American Indians and Alaska Natives are at least twice as likely as the general population to become addicted to drugs and alcohol, and 3 times as likely to die of a drug overdose. They have the highest alcohol-related mortality rates and rates of substance abuse and dependence among all racial groups. They have the highest rates of use of marijuana, cocaine, inhalants, hallucinogens, and non-medical use of prescription drugs than any other racial group. In fact, a recent CDC report said that the death rate of Native Americans from opioid overdoses was the highest of any racial demographic. Additionally, the use of meth appears to be high in some tribes and is becoming a serious concern for many Native American communities. Slides 2 through 4 show examples of these startling statistics. Interestingly, substance abuse patterns have shown great variation, sometimes related to tribe, region, gender, or urban or rural status. Working in the IHS, we've all witnessed the high rates and devastating effects of substance abuse in our patient population, and noticed the lack of resources available to them. Obviously, something isn't working. Even though Native Americans have the highest prevalences of substance abuse and dependence among all racial groups in the United States, they are served by the country's most complicated behavioral health system. Substance abuse treatment services for natives are provided by tribes, tribal organizations, urban Indian programs, the Indian Health Service, the VA, state, local, and other programs. Large numbers, probably the majority of Native clients treated for substance abuse disorders, are served by the agencies apparently unaffiliated with the IHS or tribal organizations. Only about a third of Native American people reside on reservation lands. Some urban Indian cultural centers serve hundreds of different cultures, which also makes culturally specific urban prevention programs impractical. However, recent data seems to suggest that cultural adaptations that proceed tribal nation by nation may be more respectful and manageable. Some of the treatment programs have also recently begun to look at substance abuse treatment in the context of historical trauma theory. As you can see on slide 5, researchers have hypothesized that trauma that includes the suppression or destruction of indigenous culture may result in emotional and psychological injury that is transmitted throughout the generations, resulting in unresolved grief, depression, low self-esteem, and anger. The resulting emotional injury in turn leads to self-destructive behaviors such as drug and alcohol abuse. Unfortunately, in many Native American populations, chaotic family lives, suicide, mental illness, addiction, domestic violence, and other trauma are the norm. As referred to on slide 6, a major source of intergenerational trauma was the U.S. boarding school policy that attempted to assimilate Native Americans into the rest of the nation's culture by shipping thousands of Indian children to boarding schools all across the United States. Many of the children were abused, and most lost their cultural identities. Intergenerational trauma has been shown to be associated with increased rates of depression, drug abuse, and addiction. Thus, treatment for a client in recovery from substance abuse who has experienced historical trauma involves helping the client reconnect with his or her cultural roots as an integral part of the healing process. As mentioned earlier, there's immense diversity in substance abuse among different Native American cultures and communities. There are over 560 federally recognized tribes and about 100 other tribes that are recognized by individual states. These tribes speak over 200 distinct languages and vary widely in economies, traditional ways, and spiritual beliefs. Access to prevention and treatment interventions is a major barrier for many Native Americans. And given that a large portion of the Native American population resides in remote locations, delivering interventions can be difficult. Under the Indian Self-Determination and Education Act, or 638 as we know it, tribes and tribal organizations have the option to either administer or assume control over healthcare programs and services the IHS would otherwise provide. In essence, tribal governments have the right, theoretically, to develop health systems that are culturally sensitive and appropriate to their specific needs. For example, a handful of affluent tribes across the country have been doing this. With money from casinos and other tribal businesses, some tribes, mostly near major cities, have been able to build world-class healthcare facilities on the reservation that include addiction treatment programs. Recent research on culturally tailored, evidence-based, and community-level interventions does indicate that these can help prevent substance abuse. The fundamental premise behind culturally based interventions for Native American people is that restoring a culturally centered sense of self and instilling a sense of pride in one's heritage and spiritual traditions will provide a protective barrier against further abuse of alcohol and drugs. Cultural identity and participating in traditional practices, including traditional healing practices, can be a source of strength and connection for Native American communities. Some tribal program examples are shown on slides 7 and 8. Now, there is a rich history of healing among Native American people that is often not captured by the Western research literature. Although some tribal treatment programs have incorporated various traditional pan-Indian healing modalities such as talking circles and sweats, the staff at these clinics may also refer clients to ceremonial specialists. Some tribes have even attempted to combine Western treatment approaches such as Alcoholics Anonymous with Native traditions. For example, Winslow Indian Healthcare Center, where we all work, is a successful tribally run health center serving a portion of the Navajo Nation. It has a traditional medicine practitioner on staff, as well as an active health promotion and a disease prevention department that coordinates several traditionally focused community outreach programs, trainings, and conferences, as seen on slide 9. I believe we can do even more. I believe that you would agree that the Native population that we serve definitely has a need for major substance abuse prevention and treatment services. I suggest that tribes and tribal organizations, such as our Winslow Indian Healthcare Facility, should take it upon themselves to invest in continuous, culturally relevant substance abuse treatment and prevention services by either operating their own or partnering with nearby facilities. This would go a long way in helping to raise the physical, mental, social, and spiritual health of American Indian and Alaska Natives to the highest level, which in fact is the mission of the Indian Health Service. In summary, the current treatment options are not enough and they're obviously not working. Interestingly, prior to colonization, the use of fermented substances and hallucinogenics was not unknown to tribes throughout the Americas, but ingestion of such substances was restricted to the context of ceremonial or healing practices. The prohibition against the abuse of these substances was strictly observed. However, with colonization came the rapid introduction of alcohol and subsequent abuse and addiction, and traditional healers at the time were unprepared to cope with the new disease they encountered. As you can see on slide 10, Dr. Ron Shaw, the president of the Association of American Indian Physicians, recently stated in an NPR interview back in November, "We've always known that culture is prevention when it comes to drug use or drug abuse at an early age, but culture is also treatment." Thank you.